Now I'd like to introduce Lisa Huckleberry. Lisa is the parent consultant for the Family Center for Children and Youth with Special Health Care. This is the statewide parent-directed center within Children's Special Health Care Services and the Michigan Department of Community Health. Give it up for Lisa.
Hello, everyone, and thank you very much for having me. Can everybody hear me? Turn it down. Is that better? Okay. I usually speak really loud, but like I said, thank you so much for having me. I used to live in the Wayne County area, and now I live up in Lansing for my job, and I forgot how horrible the traffic is here. I thought I knew how bad it was, but I completely forgot. So I apologize as I just strolled in. And so my position is a parent consultant within the Family Center, which is the parent-directed center of Children's Special Health Care Services. And hopefully many of you are familiar with Children's Special Health Care Services. If not, I hope to share with you a lot of information about what we call CSHCS in short, and the Family Center as well. Because Children's Special Health Care Services actually only covers 0 to 21 except for 2 conditions, and cystic fibrosis is one of them that we cover for lifetime. And very, very lucky to have this in the state of Michigan, as many of the other states do not cover this for lifetime. So I'm really excited to be able to be here and share some information. So just a little background on Children's Special Health Care. It's a program within what used to be the Michigan Department of Community Health and is now the new merged departments of the Michigan Department of Health and Human Services. And it works to provide access and guidance to families with children and some adults with special health care needs and support services related to specific medical conditions. It was actually mandated by Title V of the Social Security Act way back when, especially when polio was very heavily, everyone was contracting polio, and so it was created to find, diagnose, and treat children who have chronic illness who live in the state of Michigan. And we're really committed to trying to remove barriers for families to be able to access the care that they need and to seek out the appropriate specialist. Within Children's Special Health Care, we have also, we partner with a couple of the Family Center for Children and Youth with Special Health Care Needs, where I work, and also the Children's Special Needs Fund, which I'm not sure if any of you are familiar, and I'll go into a little more detail about that, but Children's Special Health Care Services actually oversees both of these programs. We are really committed to promoting a system of care that is family-centered and community-based. We are out doing outreach and education, hopefully more and more within the next year or so that we'll be doing much more. There's a lot more outreach that needs to be done so providers are educated to inform families of CSHCS when they have never heard of it before. But we really hope to be able to help with coordinated care and also to help others be culturally competent and also serve families in that way. And like I already shared, we do cover children, youth, and some adults who have a qualifying medical diagnosis. We do have over 2,700 different medical diagnoses that we cover. So in addition to cystic fibrosis, you may have some other health condition, or you may know somebody in your neighborhood or church that may have a child or teenager who might qualify. So we always like to spread the word because a lot of times families find out from other families. The diagnosis must, although we cover these 2,700 diagnoses, they must meet a set of criteria, which is chronicity, severity, need for treatment by a specialist at least yearly, and also they'll have to see the treatment plan and what will the long-term treatment plan look like. Eligibility must be a residency in Michigan, a citizen of the United States, or at least documented non-citizen lawfully admitted for permanent residence. And so, like I said, you have the qualifying medical condition to become eligible, residency, also the age under 21 except for cystic fibrosis and certain blood coagulation disorders, hemophilia being one of our biggest populations. Income is not a factor for children's special health care, such as other state programs, as in Medicaid. You can make $1 billion and still be on our program. We do have a payment agreement that is based on your family income and size of the family. but I believe we max out a little bit under at $3,000 per year. So a lot of families don't know, is this cost effective for me because I'm in that really high income bracket? So we tell families, you just really need to determine, outweigh it, because we help with co-pays, medications. My daughter is actually on the program. I have a daughter who was born with Down syndrome, and we don't cover Down syndrome, but we cover a lot of her health issues. She's 10, doing great, but all of her medications for her asthma are free for me. So that is a really big help, and I actually tried to go off it last year thinking maybe I don't need to pay into it, and all of a sudden just those co-pays started really racking up. So it's a huge help just in that. But we tell families, you really need to consider the benefits. I think for most families who have someone in their family with CF, I know most of those medications are very, very expensive. So we try to reach as many of you as we can. I also want to let you know that even if you have private insurance, you can still benefit from children's special health care. A lot of times it's those families that do have private insurance that don't find out about children's special health care, because we'll pick up those co-pays and they can't bill you for those. So if somebody is on Medicaid, really Medicaid usually is a payer first before children's special health care, because while Medicaid says they're the payer of last resort, Children's Special Health Care Services really is the payer of last resort. So a lot of times people who have private insurance don't necessarily find out about Children's Special Health Care, but I hope that providers are getting better about this, and once we're able to even do more outreach, that will really help. In addition, we do have CSHCS representatives within every local county health department, and they're there to serve the people right within the community. And if you do belong to Children's Special Health Care and you're not utilizing that service, and you're in need of it, they will offer complex case management. They can come out to your house if you have a child with high needs, and they can really help coordinate a lot of that care and kind of help determine if there are other specific needs that you may need that you haven't thought of or didn't realize that maybe you had access to. And you can also reach any of the people in the local health department through our 1-800-FAMILY phone line, or you can also call them directly. And in addition to the co-pays and deductibles that CSHCS helps pay, we also help with mileage reimbursement or transportation assistance. Many people don't know about that. If you call your local health department and let them know ahead of time, I think it's usually just 30 days in advance now, that you have appointments at Dr. So-and-so, they'll send you out the form, and then you can turn it in and actually get reimbursed for mileage, and also for lodging for a parent that needed to stay very close to the hospital while the child was in the hospital. They will help pay for lodging to be close to the hospital. And for me as a parent, when my daughter was 6 months old at Mott Children's and having open heart surgery, it was incredibly important. I didn't live that far at the time, but it was too far if I needed to be there right away, so it was really helpful. CSHCS also helps with equipment needs such as wheelchairs, walkers, pharmacy medical supplies, diabetic supplies, therapies. They do have some criteria in regards to physical therapy, occupational therapy, and speech therapy, but they do help with all of those as well and help to meet durable medical equipment needs. And like I already said, CSHCS is the payer of last resort, and you must follow your private insurance. So if your private insurance denies something, we will follow them first. So we cannot go against what your private insurance says. But something, having done the department reviews for quite a long time at CSHCS, I always encourage families to appeal anything that you are denied that you feel like maybe you can get covered. A lot of people say, oh no, that's just another way to get people to say, forget it. And a lot of people do say forget it, but they do actually go through, and even with your Blue Crosses, you can appeal any decision. They can still deny it, but a lot of times I know at CSHCS when we deny things, a lot of times it's we don't have the right medical information. The doctor that submitted the report didn't send us enough information, or and generally those are usually the two reasons, and especially with CF, because we do approve most people with CF, and I don't want to say all because I'm not the medical consultant. I don't make those decisions. I don't want anyone calling Lisa Huckleberry and saying, you said they'd cover it. So, but most likely So if you do get something that's denied from CSHCS, feel free to, file in a department review. Basically, though, with CSHCS, what they do is basically determine if our medical consultants have followed policy. So one thing I like to share with people is most people don't realize our CSHCS policy is all within the Medicaid Provider Manual, which is a public document within the Michigan.gov website. So I encourage anyone, the CSHCS policy is within that, and anything that falls under Medicaid, even though it's CSHCS, we bill through the same system and they pick up some of the things, then you can go through there. It's big, but it's very helpful because a lot of people just don't realize that. Sometimes they think our medical consultants just make decisions without, but they really do have to follow that the Medicaid policy. Like I mentioned before, within the Children's Special Healthcare Services Local Health Department, we have representatives, but we also have nurses on staff. So we have a rep that helps coordinate a lot of the care, but we do have RNs on staff. So if you have any questions, any complications, feel free. They're very, very helpful, and they really love working with their families. One of the benefits that we also have, or it's kind of a side program, is the insurance premium benefit program through CSHCS. So CSHCS may pay a portion of a family's health insurance premium through employment, a policy purchased by the family, or COBRA. They would determine if it's cost effective for us. So many times, if a person is just on Children's Special Healthcare, so we're paying all of that. And if somebody is in threat of losing their job or losing their health insurance, we may pick up that health insurance because it's cost effective for us to pay your insurance premium than to let it go. So if that's something anybody ever comes across, please feel free. You just call CSHCS and they'll connect you with the girl that does that within our office, and she will do all the paperwork to determine that. I mentioned earlier the Children's Special Needs Fund is a fund that's a program that's also housed at CSHCS, and basically it's to provide families with different equipment that nobody else will fund. So a lot of times it could be van lifts, ramps, other things that nobody else will fund. It is an application process, but they also will do electrical upgrades for children coming home on vents. So a lot of times, the reason a child can't go home is because they cannot have that vent within the house. They don't have the right electrical equipment. So that is one of the things that they will fund as well. Anybody can apply. You just have to have a CSHCS qualifying diagnosis. You do not need to be on the program. But the local health department, again, can help you with that. And I brought brochures, so I will leave them here for Children's Special Healthcare and the CSN Fund. So if you have any questions, all the information and contact information is there. So a little bit about the Family Center. The Family Center is the parent-directed center, like they mentioned earlier, within Children's Special Healthcare. It was actually founded in 1988, and Michigan was actually one of the first parent-led initiatives within the Title V organization housed in Michigan across the country. So we kind of led the way, and it's really about having parents who have children's special health care needs on staff because we're the ones living the life, but we also seek, and I don't know if he probably isn't here, but we did have somebody with CF who was on our Children's Special Healthcare Services Advisory Board. So we really like to bring people in who are utilizing the program because, who knows better than anyone who is using it, what's working, what's not working. And so right now we are currently fully staffed in our Lansing office. I've been there 5.5 years, and this is the first time. We had an office in Detroit, and the previous director, we just hired a new director without a director for a couple years, and I was kind of housed there alone. So we are up and moving, doing a lot of great things. And one of the wonderful things that we are doing is we offer scholarships for families to attend a conference. So it could be for a parent, or it could be a youth or young adult to attend a conference in regards to the medical diagnosis. And it can be out of the country. I mean, not out of the country, sorry. I always wish it not out of the country. It has to be within the United States, but it can be out of the state of Michigan. We will cover airfare for one parent and one youth young adult, which we go up to age 26 because that's what we follow the special education in Michigan, which is up to age 26. We will cover lodging, meals that aren't covered by the conference, mileage reimbursement if somebody wanted to drive, registration. And it's an application process, but we do have a lot of funds to cover people. Now, if we all of a sudden have an influx of everybody wanting to go to the same conference, they'll have to pick just one or two, but it's an easy process. You get half the funds up front and then the rest as you return with your receipts. So I'd like to share that with everybody. Not many people know about that, and it's just a really great thing that it's very hard to go to conferences. They're very expensive. Some of the conferences you need to go to are far away. So we're really happy that we can help with that. And we also have a parent-to-parent mentoring program. So if anybody would like to, maybe it's a new parent with a child with CF, would like to speak with another parent, we have trained parents within a database across the state of Michigan that we can connect them with another parent for parent-to-parent support. It's an evidence-based model. Parent-to-Parent National USA is a nationwide program, and evidence shows that caregivers are really, really stressed out. They spend a lot of time, not just caregiving for the person, but just making those appointments, going to those appointments, just dealing with all the red tape and all the systems that they have to deal with. And it takes a big toll. And the evidence shows that having another parent who's been there is really able to help us reduce some of that stress, help parents feel really empowered, and ease some of that isolation, especially, when you have someone that's newly diagnosed and maybe you've never even, I know for me, when my daughter was diagnosed with Down syndrome, it was prenatally, and I didn't know anybody who had Down syndrome, and I luckily was able to meet a lot of other people, but for me, it was a huge help. I can't imagine getting through those first days without somebody else who had been there and done that to help me along the way. So we're doing a lot of other programs too. We just did a statewide SIB shop training. So we're trying, for those of you who don't know what SIB shops are, they're workshops for the siblings of the child with special needs. I apologize. And so we have trained now 51 trained facilitators by Don Meyer, who is actually known as the SIB shop guru. He's known actually worldwide for the work he's done for siblings. He himself is a sibling. He has a lot of great books out there. He knows what it's like, and so we hope that a lot of these people will be bringing this to their own communities, and I believe we had quite a few people, or at least a couple of people from your area. So that will be something, if you can tap into CSHCS, and our Family Center will be doing newsletters soon, so we'll be getting that information out to families. I did bring in a sign-up sheet if anyone would like to sign up to be on our email list. We will be starting the newsletter soon, and hopefully we'll have a lot of sibling shops going around, because siblings need the support as well, and sometimes it's difficult to take care of everyone when you have somebody who has a lot of special health care needs. So that's another wonderful thing that we're doing, and we can actually help just parent-to-parent mentoring over the phone. All the parents on staff have a child with a special health care need. We all have children with different abilities, different disabilities, different health issues. And so if anybody, seeking help in either learning how to navigate a system, trying to figure out how they can access certain supports, different things like that, they're more than welcome to call our family phone line and ask to speak to one of the parent consultants within the Family Center. And we don't just talk to parents of CSHCS qualifying diagnoses. We talk to all families who have a child with special needs. Or, even if you had adults call that needed connections to the community mental health, how to access the rest of it through there, we can help with all of that, or at least be a one-stop shop to connect you to the people that can. And so we will be doing a lot more great things with the Family Center. We are doing some parent mentor trainings, 1 or 2 more around the state. We did one in Dearborn last year, or early this year, and next year we will be doing more. So if there's anybody interested that would like to become a trained parent mentor, we'd love to add more parents of children with CF to our database, because there is a big need for it. And actually, we can even go outside of our Michigan database with the P2P, the Parent-to-Parent National Program. We have access to all the other parent-to-parents across the United States. So if there's a listserv, we can go and post and see if there's another parent, even if it's in another state, for some of the rare issues. Does anybody have any questions? Or I'll leave some business cards, so anybody feel free to contact me. And I wish, feel free to call me anytime, and I will be more than happy to answer any of your questions. Thank you.